The Sacramento River Delta is a lush, verdant landscape that's bounty feeds California and the rest of the country. It may seem to its residents a little bit of paradise until someone gets sick. The Sacramento Delta region is a federally designated health professional shortage area. In a 336 square mile area with over 11,000 residents, there is only one primary care provider.
The greatest health challenges for most people in the Delta are the fact that we're underinsured or uninsured, and we live 30 to 45 minutes from the nearest facility.
People representing Delta communities approached the Department of Family and Community Medicine to explore options for increasing access to care in the region.
Sort of the way that we viewed our role was trying to do the legwork and get the infrastructure in place and get people connected so that the community could really sort of take ownership of this and get a clinic up and running.
Community is at the core of the training that medical residents receive at UC Davis.
As our department name suggests, Family and Community Medicine, we believe that really creating health for the community and health for people is not just about seeing people as individuals and treating them as individuals, but also treating their entire family and by extension the whole community.
Communities and Health Professionals Together, known as CHPT, was developed as a means of educating new physicians on the importance of community outreach, advocacy, and community service.
So in their first year, what we do is introduce them to the communities that surround us here at UC Davis. So they go out to Oak Park and surrounding communities and learn what resources are available for patients.
I think it's really important for them to know about the community that they're working in. And that's what the residents seem to really like about coming and visiting the different organizations in the community. And they get a chance to learn about some of the services that are available. So if they know of someone struggling with foreclosure, which adds a lot of stress and impacts health, they can say, well, NeighborWorks helps families that are dealing with foreclosure.
So the residents have come, taken a tour of our facilities, gotten to familiarize themselves with the free services that we offer the community, and then also spent some time volunteering in our food programs and at our food distribution.
Just in our curriculum alone, we are sent out in the community frequently to different sites to learn about underserved community, work at federally qualified health programs, in centers, and then there are a lot of extracurricular things if you want to get involved as well.
And then in their second and third years, since they've met different community partners, I ask them to pursue what they're passionate about and work with community partners on projects that improves the lives of our patients.
With collaboration between faculty, residents, medical students, undergraduates, and the local population, student-run clinics exemplify UC Davis's commitment to community engagement.
At UC Davis, we do a lot of different projects within the community. So we have 8 student-run clinics that each serve different populations, and those are very active and a very vital part of the school.
Each of the student-run clinics has sort of evolved in concert with a community, whether it's patients who speak a particular language or are of a particular ethnic background, or in the case of the Gender Health Clinic, are transgender or LGBT.
The Department of Family and Community Medicine started Clinica Tepati in 1974. At the time, it was one of the first student-run clinics in the country. The department is actively involved in the Imani Clinic in Oak Park, a rural clinic in Knights Landing, and most recently, a gender health outreach clinic.
This population will not come to our clinic because of many barriers, including health insurance and feeling uncomfortable. And so going to this gender health center puts us in the space where they feel most comfortable, and also puts us in the space where we learn about their resources and their needs collectively and can be the learners.
The department's vision for community engagement involves the development of mutually beneficial partnerships with established community agencies so we can build long-term community impact.
The most popular project that we were able to have the residents be a part of was what we called the PAL Summer Swim Camp. Those projects wouldn't have been possible. We couldn't have taken all those kids to the camp without that program.
In California, there is a tremendous need for medical providers from diverse backgrounds. Through Future Faces of Family Medicine, local youth learn how to prepare for medical school and careers in healthcare.
I think it's really important that UC Davis has programs like this to give students like these opportunities.
They learn a lot of different techniques on how to enhance their applications for college, how to think about positioning themselves to get into medical school or other professional schools. And also they get paired with a mentor. And many of them have never interacted with professionals in the healthcare community before, so that step's really important for them.
I'm really interested in joining the medical field and possibly pursuing a career in the medical field, so I thought it could be a great opportunity for me to learn stuff about it and to be engaged in it.
Past resident projects have included creating community gardens, training high school student athletes to prevent and recognize concussions, preventing dog bites, and nutrition education.
Seeing people outside of the clinic and outside of their hospital gowns makes them human, and it teaches us humanism, and I think that that element is something that we strive to all practice.
Just as physicians must listen to patients to provide optimal care, by listening to the public, the Department of Family and Community Medicine is making a difference in the health of the communities we serve.
I feel that advocacy is like one of the cornerstones of family practice, and therefore community medicine has to involve the community.